Welcome to the Texas Children's Hospital Healthcare Hackathon. 1 out of every 7 people in the United States is food insecure. That includes about 15 million children, or 1 out of every 5. Nearly 300,000 children will be diagnosed with cancer this year globally. There are parents who can't read, houses that don't have internet access, and suicide rates and mental health needs are rising. These are the things Texas Children's and likely the hospitals and doctors in all of your communities are trying to tackle every single day. But that's not all. Just for a second, I want you to imagine having conjoined twin girls that share almost every major organ, including their heart. I want you to imagine needing to save a life before birth with fetal intervention and surgery, or perhaps performing a life-changing surgery to allow a child to hear for the very first time. This is what we do at Texas Children's, and this is why people come here. If it's one thing that I hope you take away from this opening, it's this. The work you do over the next 10 days matters. It will have a direct effect on people who are going through some of the toughest and the most beautiful moments of their lives. We are so grateful and appreciative that you've decided to participate in this event, and we can't wait to see the digital solutions you come up with.
Nothing in our control, nothing known. Is it safe out there? We don't have all of the answers, but hopefully we can calm some of your fears when it comes to getting and keeping kids healthy. We're here. We've been here for over 65 years. This is our wheelhouse, and we're comfortable here. Providing ear tubes and cutting-edge cancer treatments, healing broken arms and the most complex heart problems, helping families grow, and treating babies that are still in the womb to those heading off for college soon. Leading the way in quality, safety, patient care, outcomes, and access for all. We don't just care for you, we care about you, during good times and especially during bad. We're Texas Children's Hospital, and we're here for you, yesterday, today, and always.
Hello, I'm Melanie Lowther, Director of Entrepreneurship and Innovation for the Texas Children's System, and I am so happy you're here. Texas Children's Hospital has been a leading figure in pediatrics and a strong fixture in Texas since opening its doors in 1954. We've made our mark pioneering life-saving treatments and developing innovative ways to deliver medical care for over 65 years. Now we're bringing it all together with our plan to build the hospital of the future in Austin, Texas. Our vision for this new hospital is to think bigger than ever before, and what a better place to do that than in Austin. And what a better time to do that than now, when we're challenged to find new ways to work and new ways to serve our patient families. Just this morning, we broke ground on our new state-of-the-art hospital in North Austin. Set to open in early 2024, the 365,000 square foot, 52-bed hospital will address the need for expanded pediatric fetal OB/GYN care in the Central Texas area. The hospital will include neonatal intensive care, pediatric intensive care, operating rooms, epilepsy monitoring, sleep center, emergency center, fetal center for advanced fetal interventions and surgery with special high-risk delivery unit, as well as a state-of-the-art diagnostic imaging, acute care, and on-site Texas Children's urgent care location, and of course, more than 1,200 free parking spaces. Additionally, an adjacent 170,000 square foot outpatient building will connect patients and families to Texas Children's numerous subspecialties, including cardiology, oncology, neurology, pulmonology, gastroenterology, rheumatology, fetal care, dialysis, and many more. We are so excited to see what ideas we can incorporate from this hackathon into our Austin planning, including our 12 existing Austin locations and all of our hospitals and operations in the greater Houston area and across Southeast Texas. One of the reasons we're thrilled about your participation is because we anticipate that you bring a unique perspective and an unprecedented level of diversity and expertise to tackle some of our healthcare's biggest initiatives. This group of participants, you range from college students to senior tech leaders. You might work in the telecom industry or energy or finance. We have people registered from California, New York, Florida, and everywhere in between. Most importantly, though, each and every one of you has had your own interactions and experiences with healthcare. Some of you may have had surgery, or you visited a family member in the hospital. Maybe you're pregnant or trying to start a family, or perhaps you've needed to take your child or a loved one to a doctor's appointment or an urgent care. Some of you may have had negative experiences, trouble scheduling an appointment perhaps, or difficulty understanding the clinical jargon or process. Or maybe you had trouble finding your way around the hospital and how to connect to a telemedicine visit. Use your personal experiences as guides. We want to know what went well, what made it so, how can that inform your new solution? What went poorly and why? In an ideal future world, what should this experience look like? And then you get to build it. I have about 20 more minutes of content for you. I'm going to take around 3 or 4 minutes to review the event structure, agenda, submission guidelines, and resources with you. Then we'll spend most of our time introducing the themes. After a quick shout out to our amazing sponsors, I'll wrap up the session for the day. Let's begin with the event structure. You're invited to submit solutions to a theme. Each theme will be judged by a panel of Texas Children's executives, leaders from the theme sponsor, and representatives from our Patient Family Advisory Group. 3 winners will be chosen from each theme for great prizes and the opportunity to compete to be the overall hackathon winner. This winner circle will award the top 3 overall hackathon solutions with fantastic prizes from Hewlett-Packard Enterprise. The 4 Kids by Kids challenge will stand alone and will be judged in the same time frame. This theme also has great prizes, including an opportunity to showcase your work at Texas Children's, and every participant gets a hat from our sponsor, the Butler Bros, as a token of our appreciation for your participation. Please make sure you have submitted your signed parental consent if you're participating in the 4 Kids by Kids challenge. All winners for every challenge and theme will be announced on June 9th as part of our closing ceremonies. Switching to the agenda, on your left navigation pane, there's a link to the event agenda. There you'll see Healthcare Ask Me Anythings powered by Press Ganey. Use these AMA forms to submit your questions and we'll provide answers. There are also a couple of planned workshops which will be available on demand. The Texas Children's Information Security Group has graciously offered to share some of their insight. If you are new to working with healthcare data, I strongly encourage you to tune in on Monday. All projects for all themes and challenges must be submitted by 11:55 p.m. Central Time on Monday, May 24th. Judging will take place over the next several days with winners announced on June 9th. Let's talk about project submissions for a moment. In addition to providing code as you normally might for a hackathon, we're asking for 2 other artifacts which we hope will help your solutions come to life for our hospital executives. The first is a business canvas model. Think about this as a 1-pager that gives you an opportunity to provide more context about the solution you've built. It'll help us understand very quickly what problem you decided to tackle, who's the audience for it, why is it important, and where could you see it going? The second is a brief 1 to 3 minute video with a lot of the same information as the business canvas model, along with a quick demo. We hope this opportunity to provide more context will help us get to know you and what problem you're solving. We'll provide more information about submissions next week. A quick note about our technology stack. We are an Epic shop, and as our electronic medical record, or EMR, it's at the core of everything we do. And no, you will not have access to any patient data during this event. Epic is our documentation source of truth and where all clinical work takes place. Integrations and bolt-on apps do exist, but consider this a heavy lift. For more resources, click on the TCH Hackathon APIs link, again in your left navigation menu, to find information about our APIs available to you, as well as Epic developer resources. And finally, there are tons of great developer resources, tools, and other content on the About pages from our sponsors. All right, let's dive into the themes. We know that the themes we provided are very broad, and we realize that many of you who don't work in healthcare might not know where to begin. So We've created some short videos, which we'll watch to provide some additional insight into what each of these themes means to someone at Texas Children's. Between the videos, I'll share some broad healthcare specific considerations that may not always be top of mind. The videos are individually available if you want to review them again at a later date. And there's more information in the themes section of the Hackathon website.
Food service here at Texas Children's really ranges for both patients and their families and visitors. So when we talk about our patients and the food they receive, there's opportunity around ensuring that they get their trays on time and that the food is warm. Obviously, it's not warm because it's not on time, and that has to do with the physical distance between the kitchen and where they're being delivered. The other challenge is that we realized, oh gosh, probably 2 years ago, that our families often were facing hunger while their child was inpatient here at the hospital. Because of that, we instituted a program to help support those families with no-cost meals to them through a philanthropic donor. However, there's limits to that because of the size of the kitchen. Here at the hospital, we've got a coffee shop, we have what we call the bistro, and then we have what everyone calls the food court. The food court is more family-friendly fare, Subway, Chick-fil-A, things like that. The bistro is really geared more toward our women patients and their families, as well as the employees. Beyond that, we really don't have any options. There's vending machines. You can go across the street and down a couple of blocks to other outside places like Chipotle, Salada, but there's just not a lot here. And when you're here, the campus is so big. One of the things that we pay particular attention to is for our patients who have special diets. So for example, if you have a patient, adult or pediatric, who's on a low salt diet, there's limitations in the food that they're able to access. Looking at those special diets and finding ways to provide more variety to our patients is important. At Texas Children's, we define patient experience as delivering an experience that is personalized, is safe, first and foremost, safe, personalized, present, and compassionate. And so we really hone in on that personalization piece. And I think that if we're able to personalize the food experience for our families, for our patients, it'll be a game changer.
So you might be wondering why we began our first video for a healthcare hackathon that was all about food service and delivery. And it's because it's that nagging problem that's been around forever. It impacts everyone, and it just hasn't been solved yet. It's mostly we don't have enough space to add food areas without taking away from necessary patient care. And a quick note, the venues that you saw in that video are from our medical center campus in Houston, and not necessarily the Austin campus that we're building today. But the timing really hasn't been more right to address this need for better food service and delivery. We want you to tackle this with the needs of every stakeholder in mind, whether it's patients with dietary restrictions, patients just wanting a comfort meal, families sitting at the bedside, staff, and more. Some considerations are ideas like food delivery, outside food delivery vendors like Favor or HEB Digital, cloud kitchens, dietary restrictions, food insecurity with food deserts and how they can be addressed with food banks, and childhood obesity. Let's jump into our next video.
When we're meeting patients, where they are, basically we have to make it so easy that it's just like walking in a door to meet somebody, both for them and for the provider.
Traditionally, in the traditional model, we have hospitals or healthcare providers at the center of the healthcare model. And instead, we want to put patients in the center. We want to provide personalized, customized care, meeting people with exactly what they need when they need it.
Technology, obviously it depends on the computer hardware or personal devices that the provider is using, but equally on the patient side. And then we've got bandwidth, because really you can only have a successful visit if the connectivity is good. And bandwidth issues, and if somebody's on cellular or Wi-Fi, both the provider and the patient, those are a lot of challenges. We don't want technology to be a barrier. We want it to be so easy that you really feel like you're in the same room together. that you can focus on that clinical interaction just like you were together in the same room.
Technology should really be an enabler to better patient care as opposed to a distraction. Telemedicine is a really fantastic example of how we are meeting people where they are. And beyond that, it's not just using it for virtual visits, it's really thinking about how we can do that on an inpatient setting as well, and also with remote monitoring of our patients while they're at home.
I think the important thing is there's so much good that can still come from telemedicine. Let's not give up on it, and let's just make it better.
If what we wanted existed today, we would just buy it off the shelf. That's why we're opening it up to you to bring in your creative ideas.
Meeting people where they are. This is an incredibly broad topic, and that's by design. The video you just saw focused a lot on telemedicine and e-health tools, which is certainly something that is very relevant to us at Texas Children's and to all of healthcare right now. However, at the core of meeting people where they are, it's all about meeting each individual's needs and how we can deploy digital solutions to improve their journey or experience. We want to find equitable solutions that can provide better access. Another thing to consider is tools to help us identify needs as we go or at the point of care. So maybe we don't know a patient is depressed when they arrive for their in-person or video visit, but their voice biomarker picks it up and alerts us. This exists, by the way, pretty cool. Maybe it's an AI algorithm or NLP product to help identify these needs as the world continues to change. There are so many opportunities to address meeting people where they are. Next, let's dive into the touchless experience.
The COVID-19 pandemic forced all of us to rethink our interactions with each other and our environments. Previously normal physical touchpoints became uncomfortable, and we shifted to a more touchless experience. This shift also occurred at Texas Children's Hospital. From screening locations to plexiglass installations to MyChart pre-check-in and more, we strive to provide a seamless, touchless experience for the patient family as soon as they walk into our buildings. Opportunities to improve the patient experience also include wayfinding so patient families can navigate our campuses with ease.
The COVID-19 pandemic forced us to rethink how we physically engage with our patients and their families. We want to rethink and reimagine some processes traditionally done face-to-face, like check-in or payment, which might not contribute a lot of value to the overall patient experience and could transition to a more touchless one. Many of these processes include patient data. As I mentioned earlier, if you get a chance, please check out the workshop by our own information security group on Monday to learn more about HIPAA, PII, and PHI. And if those terms sound foreign to you, that is definitely a cue to attend.
I think that AR and VR offer us a lot of exciting opportunities for engaging our patients and families. I work in pediatrics, and a lot of our kids are less interested in just the standard forms of education if they're learning about a new diagnosis or what to do when they go home. Most of the materials we have right now are just black and white on paper, maybe a video if we're lucky, but usually it's pretty dry. And I think what AR and VR do is provide us with a really exciting way to engage those patients, no matter what age they are. AR and VR are actively being used in medical training. So now, especially this year with the pandemic, medical students are learning anatomy virtually, and a lot of what their understanding and engagement is with simulations of the body, where they're learning anatomy through virtual reality, which is super exciting and cool. Other opportunities, and I think ways that we're trying to use it more with patient education. We have amazing nurse educators who are very enthusiastic about getting families involved and getting kids involved in their own health, and tools like augmented and virtual reality just basically amp up the possibilities. I think AR and VR offer us an opportunity to translate what's happening in the clinic and in the hospital to home. So it's a way for patients patients and families to take what they're learning in the clinic or in the hospital, aspects of their health that might be difficult to conceptualize verbally but are much easier to explain visually, and take that to and actually use it as a tool to both remind themselves of what's important, but also educate their families and friends about what's going on with them. When you have something novel and exciting, something where they feel like they're in the moment, they're present, they're really seeing and interacting with what's happening, that's cool. And that's something that I think a lot of our patients are looking for in a way that we can bring augmented virtual reality into healthcare setting.
The number of use cases for augmented and virtual reality are only limited by our own imaginations. There are clinical applications as far-reaching as training for clinical staff to pain mitigation for patients during procedures. Outside of clinical applications, there are opportunities like familiarizing families with new spaces, wayfinding, and so much more. During that video, you probably also saw a lot of great opportunities to interact with our patients, and that introduces our final theme, the evolution of child life experience.
The Child Life Department is full of health professionals who focus on the psychosocial issues of children in the hospital. Many of you may not have heard of Child Life before. This group of people really helps children cope while they're here. Children can be very anxious because the healthcare environment is not a typical, experience for children when they're growing up. And so we focus on educating them perhaps on a new diagnosis, preparing them for a procedure or a surgery, or even supporting them during a visit to our emergency room to make sure we bring down that anxiety and increase their ability to cope. In this post-COVID world, just like all of you, patients and families at Texas Children's have been impacted significantly. For their safety and well-being, we're following several mitigation efforts such as social distancing, masking, additional PPE, and these are all unusual experiences for children to encounter, especially here at the hospital. When you think about masking, for example, they can't see the faces of the people that are caring for them, or the social distancing. They can't gather in our playrooms or our activity areas and play as they normally would due to COVID-19 restrictions. And so we're having to really innovate and be creative as we focus on continuing to meet their needs while here in the hospital. When we work with children, first and foremost, we're thinking about their developmental age. How can we approach and work with a child really and meet them where they're at? We also think a lot about providing choice to children in the hospital. As you can imagine, there are many things that happen here that children don't have a choice about. So giving them that control allows them to cope a little bit more effectively with the hospital. We also want to have activities that are engaging so children can play. As we know, play is normal for children. That's how they learn, they grow, they develop, and play is such a critical part of that. And then lastly, when we think about, activities for children in the hospital, we also have to remember all of the HIPAA and confidentiality restrictions that hospitals, have in place. And so it really is these things that we keep in mind as we're developing innovative ways to bring that play opportunity to children.
Child Life is the connection point for us. They really do amazing things for our patients and help mitigate those serious, tense clinical moments. They help kids cope with injuries and illnesses and scary situations like surgery. They also help families and siblings cope and prepare for the changes in their loved ones' lives. Child Life specialists use a lot of different tools, which can include any number of approaches, including our hospital dogs for canine therapy, art, music, video games, baby dolls, or simply explaining procedures in a way that makes sense for our patients and their families. Remember, there are far fewer child life specialists than there are patients, so improving efficiencies of how we can engage with these patients is absolutely needed. Before I close, I want to thank our amazing sponsors, Hewlett-Packard Enterprise as our overall sponsor, our theme sponsors of Google Cloud, HEB Digital, NVIDIA, T-Mobile for Business, Unity, and the Butler Bros, as well as Microsoft, and also our innovation ecosystem partners, Mark III Systems, our hackathon manager, Time Studio, Paraveda, My Coding Place, Future Set Tech Camp, and Pressgamy. To you, our participants, what you do here over these next 10 days matters. Thank you for joining. Thank you for thinking outside the box and pushing envelopes. And most of all, thank you for making a difference with us.
Big data that would always get bigger, ever increasing, ever expanding. Every car a sensor, every phone a suggestion, every region a cloud, everything a thing. Data was the golden promise of the information age. But more informed does not equal more intelligent. It's time to move to a new age, the age of insight. Now insights can combine with other insights, and ideas can have ideas. Everything from edge to cloud can be connected by a single force, revealing opportunities you never knew were there. For smoother experiences, more intuitive products, and services yet to be imagined. Now entire workflows can move faster, powered by supercomputers built to the task. Solutions delivered as a service, from analysis at the edge to operations in the cloud. Wherever your data, wherever your applications, they'll be faster, accessible, and secure, bringing everything in sight. Welcome to the age of insight.